can you talk about some of the recommended interventions for patients who may be struggling with these specific challenges that are current right now?
Sure. I think in terms of specific intervention, there isn't necessarily a protocol or a standardized way of doing. What I found to be most effective is when men are given the opportunity to almost take the mask off, and really discuss some of the difficulties that they're having, whether that be with whatever provider. Maybe it's a neurologist, maybe it's a psychologist, maybe it's a social worker. I just think having the opportunity to, from our end, the provider end, to compassionately and from an awareness perspective, have these discussions, and it almost allows the men to, from a foundational sense, really talk more about what the struggle is, and it's okay to talk about that. And I think that when we kind of can take away that that shield and that conflict that they're having, by I think us as providers really play a role in lowering that a little bit, in terms of how we're coming at men and how we're having the conversation. I think is really important. I think once we do that, because we have a really great men's group here that we started, of being a lot of referrals for men, and we've seen a lot of success. And I think when you do that, it allows for this, more flexible way to identify themselves. Where, what happens here when we rigidly adhere to traditional gender norms is we kind of polarize our experiences. We're doing it or we're not, right? We're either providing or we're not. We're either, emotionally restricting or we're crying. But really there's a lot of gray area there. So it's really flexibly having these discussions, and that's a lot of where we steer things. And when you do that, it allows men to have the opportunity to re-identify with how they're providing. Maybe it's not the same way, right? But it's still happening. So things like that. That's really where we steer things in terms of intervention. Flexibility is one of my favorite words, and again, adding in that self-compassion, and really giving men the opportunity to again not get rid of some of these gender norms, but be flexible within them to further navigate their process. But it's also coming from an independent standpoint where they're defining what that looks like, and you're just supporting them in that process.
What do you foresee futuristic wise as the long-term impact of these types of conversations becoming more normalized between patients and their providers for maybe even future studies too?
Yeah, I think you kind of hit the nail on the head there in terms of accessibility, in terms of help seeking. You're creating a new environment that's a supportive one, a safe one, that feels maybe a little bit more comfortable for the men coming in. And I think in the future, I think this is so helpful because we're really just scratching the surface with this. When I first started doing this research, I really had to dial it back because it got like, hey, just, not so much, just start here and let's build on. So that's the plan, because really we're just identifying, like I said, certain gender norms. And we're also giving credit to what gender norms are actually helpful in terms of treatment adherence and health promotion, and which ones are more tricky and kind of have more of a conflicted relationship. What does this look like with different generations of men, older men compared to younger men? What does this look like with different races of men? I think these are all really good questions. And I think, again, with just scratching the surface, we can really identify a lot of these variables. And again, informing ourselves, informing us and the provider, and to know how to be there specifically for these men dealing with this disease.